nurse for today, and we're going to be doing a head-to-toe assessment if that's okay with you.
Yeah.
Yeah? Okay. Before we get started though, I'm going to go wash my hands and gather my supplies. I'll be right back. Okay. So, how are you doing today?
I'm doing good.
Good. Can I go ahead and get you to give me your full name and date of birth, please?
Nicholas Ryan Davis, 12/23/98.
Okay. Want me to go ahead and check that? Perfect. Can you please tell me where you are today and the date?
My house, June 3rd.
Okay, perfect. Patient is ANO times 3. Patient is sitting upright, speech is appropriate, as well as dress for the situation. Head and extremities seem to be equal and symmetric on both sides. Patient looks good. Okay, so for today, for the head-to-toe assessment, we're going to be doing some basic skills, just testing your eyes, range of motion, stuff like that. And if at any point during this process you feel uncomfortable or in pain, just let me know, okay? Okay, just look straight ahead. We're going to start with your eyes. Perfect. Okay, can I get you to look behind me at the wall? And then when I say now, look at this pen. Now. Perfect. Okay, now just follow the pen with your eyes, not your head. Great. Okay. Pupils are equal, round, and reactive to light and combination. Can I go ahead and get you to cover your left eye for me? Okay. Now look straight ahead. When you see my fingertips, just say see them.
See him. See him. See him. See him.
Good. Okay. Now shake it off. Do the other one. Okay, good.
See him. See him. See him. See him.
Great. Okay, you can put your hand down now. Okay, can I go ahead and get you to close your eyes for me? Okay, I'm going to touch your face. Just let me know when and where I'm touching you. Or where I'm touching you.
Forehead. Butt cheek. Chin. Right cheek. Nose.
Okay, good. Keep your eyes closed for me. I'm going to make a noise in your ear. When you hear it, let me know.
Ear.
Perfect. Okay, you can go and open your eyes. I noticed that the eyes are clear, they're not red, no discharge coming from them, they look clear and healthy. Ears as well. Ears are very clean. No cerumen that I'm seeing at all. Okay. I've tested cranial nerves 2, 3, 4, and 6 at this point, and they're working well. Okay, and I do notice that the top of the ears are in line with the outer canthus of the eyes, which is perfect. Okay. I don't see any deviations on the nose at all. Nose is equal on both sides. No deviations. Can I go ahead and get you to cover your one nostril for me and give me a sniff? Good. Other one? Perfect. Little stuffy today?
Yeah.
Okay, but nasal patency is good otherwise. Okay, can I get you to also say ah? Open your mouth up. Perfect. Now lift your tongue up. Good. You can close your mouth. Mucous membranes are pink and healthy. The uvula does retract when saying ah. That's perfect. I don't notice any ulcers, any lacerations, nothing odd, and dentition is very good. Can I get you to swallow for me? Good, no problems there. Can I get you to stick your tongue out of the side of your cheek like this? Other side? Good. Okay, now can I get you to make some funny faces at me? Blow up your cheeks like a monkey? Can you raise your eyebrows? Can you smile? Big frown. Perfect. Okay, good. Everything looks great. Now I'm just relax. I'm just going to feel your lymph nodes. So just sit there, okay? Submental, submandibular, preauricular, postauricular, tonsillar or carotid, anterior cervical, posterior cervical, occipital, and can you give me a big shrug? Supraclavicular are also good. I don't notice any swelling. Are you happy? Any tenderness at all? No? Okay, perfect. Now before I check your lungs, I'm going to go ahead and do your pulses, so just sit there and relax again. very strong, not bounding though. Just gonna relax your arms for me. Brachial pulse. I would say also the 2+, they're equal. Radial pulses. Also very strong, I'd say 2+. Rate and rhythm are both normal. Relax your feet for me. Posterior tibial, right behind that bone, is a 1+, but equal on both sides. And dorsalis is also 1+. Can I go ahead and get you to take off your socks for me? Thank you, sir. You can just set those down if you want. Okay. Capillary refill is 3 seconds or less, which is perfect. Can I do the same thing on your fingers? Good. Okay. Now I'm just going to go ahead and listen to your lungs. So I'm going to go to the back. I'll start with the back first. As I walk around, I notice that the anterior-posterior to transverse ratio is 1 to 2, which is perfect. Patient has not had labored breathing, no cough is present, and everything seems to be fine, not too shallow, not too deep. Okay, Mr. Davis, can I get you to lift your shirt up a little bit for me? Okay, perfect. So I'm just going to listen to your lungs in a bunch of different spots. I'm going to do the back and the sides and the front. Anytime you feel my stethoscope touch your back, just go ahead and take a deep breath in through your mouth and then release it, okay? Perfect. Now move side. Great. Perfect. Okay, I'm going to give you a little break for a second. Can I get you to lean forward a little bit and kind of hug yourself? Okay. Can you hug yourself? Don't relax your leg. I do notice that the spine is completely straight. Don't see anything wrong there. Can you sit up for me again, Mr. Davis? Okay. Can you give me a deep breath? Great. Thoracic excursion is completely normal, equal on both sides. I'm just going to go to the front. You can put it down in the back, but kind of lift it up further in the front again for me. Okay, same thing with here, 6 more breaths. Good. Perfect. Lungs are clear. No presence of bronchi, wheezing. Nothing out of the norm. Okay. Now I'm just going to do your heart. It's kind of the same thing, but just breathe normally. Okay. You don't have to breathe in really loud or deep. Can you come this way a little bit? Okay. Here's your clavicle. Second intercostal space, right sternum border, aorta, or aortic valve. Second intercostal space, left sternum border, is the pulmonic valve. Third intercostal space, left sternal border, Erb's point. S1, S2 just unequal. Fourth intercostal space, left sternal border, tricuspid valve. This one is very loud as it should be. And then fifth intercostal space, left mid-clavicular line. This is the mitral valve. Perfect. Everything sounds normal. Rate, rhythm, equal. Not bounding. You can go put your shirt down. That's fine. Okay, so everything seems normal. Now we're just going to listen to your stomach. So if you'll come over to the couch for me and lay on your back, that would be great. Just lay down. Yeah. If it's okay, can you lift your shirt up a little bit? Okay. So as I stand here, I notice that the abdomen is flat. I don't see any lacerations, any bruising, no hernias that I'm noticing, no hernia-like masses or anything at all. I'm just gonna go ahead and listen to your stomach first, and then I'm gonna feel of it, and if you're tender at any point, let me know, okay? We'll stop. Okay. This is the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Great, I hear some gurgles and stuff, but nothing out of the blue. Everything seems to be fine. Now I'm just gonna feel, let me know if you're tender at all. Right lower quadrant, right upper, left upper, left lower. And I'm not feeling any masses or anything out of the blue at all. Okay, there you are. Now can you just put your arms down by your side for me? Okay, good. Now I'm just feeling for muscle tone. Patient is very muscular, muscle tone is great. On the arms or legs, I do not feel any edema. I would say 1+, which is, perfectly normal, no swelling. Same thing with the arms. Patient is also warm but not feverish, so patient is afebrile. Okay, good. Now I'm just going to go ahead and use my stethoscope and run it along the bottom of your foot. Just relax, okay? Good. Perfect. Okay. Now just keep relaxing. Good, no signs of ankle pronus at all. Okay, Mr. Davis, can you go ahead and sit up for me? And then can you come right back over here where we were? And you go and have a seat. Okay. Now I'm just gonna check for range of motion and stuff. Can I get you to turn your head left and right? Good. Can you go up and then really far and then down towards your chest? Okay, good. Now can you do your arms the same way? Can you go forwards, backwards, put them up in the air, behind your back? Good. Can you move your wrist around? Move your fingers? Perfect. Can you kick both your legs out one at a time? Whatever you prefer. Can you move your toes and your ankles, wiggle them around? Okay, good. Okay, now I'm just going to test for resistance. Can you push against my hand? Good, same thing. Pull back, push forward. Good, hold your arms up, push up, push down. Good, go like this. Pull, push. Good. Push your knees together. Good, push them out. Perfect. Pull them back. Push them. Pull. Okay. And on your feet, can I put my hands under here? Can you push down on my hands? And then can you push up? Perfect. Okay, good. So everything seems to work in condition. Muscle tone is definitely equal on both sides. Patient is in very good shape, very muscular. Okay, we're just going to go ahead and do your reflexes next. Yeah, I'm going to bring the chair over here. Okay, can you have a seat up here for me? Okay, last is reflexes, so I'm just going to start from the top and kind of go down. Can I get your arm real quick? And relax your arm completely, let me hold it, okay? This little spot back here is your tricep reflex. Perfect. Okay, now just give me your arm again and relax it completely. Perfect, that's the brachial reflex. Keep relaxing. Good. That's the brachioradialis reflex. Can you pull your hands there? Just kind of get the back of the arm. Okay, relax again. This is the tricep reflex. Good. Okay, I'm going to gonna do the brachial again on this side. Good. And keep relaxing. This is the brachioradialis reflex. Good. Perfect. Okay, now we're gonna do your knees. Can you relax your legs for me? Good. I would say that all reflexes so far are 2+, which is completely normal. Good. And then the last one down here is going to be the plantar reflex. Just relax your leg. Good. Good. Perfect. Okay. Mr. Davis, can you go ahead and stand up? And can you walk to the couch and back? Good. Now stand there with your feet together, arms by your side. Look at me. And can you close your eyes? Good. Okay, you passed the Romberg test. Balance is great. Gait is perfectly normal, no limping. Gait is steady, and he is able to balance himself. Okay, we're actually done. So if you want to go ahead and sit down. Everything looks totally normal. I didn't see anything that was out of the blue, no abnormal findings. You had no tenderness or pain, as from what I heard from you. So I'm just going to go ahead and document my findings in my chart and wash my hands. And do you need anything to get comfortable before I go? No? Okay. Well, if you need anything, hit your call light and I'll be on my way. Okay? Have a good day. Thank you. Okay, you can stop. Okay, so no tenderness at all. When was your last bowel movement?
Yesterday.
Yesterday? Okay, were there any problems, any burning, any blood that you noticed or anything? No? Okay, good. When's the last time you urinated?
An hour ago.
An hour ago? Okay, any burning sensations, pressure, nothing like that? Okay, good.